Hello, ladies and gentlemen. Thank you for standing by. Welcome to the webinar today, brought to you by ComplyRight, Simplifying ACA Reporting, a hassle-free approach to meeting the requirements. My name is Stephanie Thomas, and I am your host today. Thank you, everyone, for attending this webinar, and welcome. I'd like to review a few housekeeping items before we begin. If you would like to ask a question, simply use the chat feature located in the lower left corner of your screen. You can ask questions at any time. If you have any audio trouble, please message us in the chat box and we will assist you. Please ensure your speakers are turned on with the volume up. Finally, with all of the information we will cover today, please note you will receive an email with a copy of the slides and a recording of the presentation by the end of the week to catch anything you missed. Now, I am pleased to introduce you to our speaker today, Stacy H. Barrow, Benefits Attorney and ACA Expert. Stacy, thank you for being here today.
Thanks, Stephanie, and good afternoon, everybody. It's Stacy Barrow from Marathis, Darrow & Weatherhead in Boston, and we're proud to partner with ComplyRight to offer today's webinar to their friends and clients. By way of background, I'm an employee benefits attorney. I've been doing this about 15 years. Our firm is a boutique employee benefits, executive compensation, and labor and employment firm located in the heart of Boston, and we advise employers and insurance brokers and other interested parties on all matters related to the Affordable Care Act and ERISA, retirement plans, and all of the other alphabet soup of laws that apply to benefit plans like COBRA and HIPAA, FMLA, Section 125, all of those fun laws. So I want to thank you for attending today's webinar on simplifying the ACA, or Affordable Care Act, reporting. I know this topic is making a lot of employers anxious, especially as you work through the details for the first time this year, so I hope this webinar relieves some of that anxiety. If you attended our earlier ACA webinar, you hopefully got a solid overview of the new reporting requirements and the related IRS forms. This background information is a necessary part of your education on ACA reporting and how it impacts your business. Today, though, we're going to take a bit of a deeper dive. Rather than broad strokes, we're going to get into some of the specifics with regard to completing the 1095 forms. It's early March right now, so many of you have already compiled the data and are working on distributing the employee statements by the end of March deadline. That being said, there's still a few weeks to gather data and you may still have questions, so I'll go through the pieces of information that you're going to need for the forms. And then from there, we'll look a little more closely at the actual 1095-C. We'll do it section by section to ensure that you fill it out properly for each employee. And then at the end, we'll wrap it up with some guidance on managing this whole process for this year so that if things are a little bumpy this first year, they'll be smoother in the coming year. And certainly we will be sharing today's presentation with you. After the webinar, you'll get a copy of the slides. We also encourage you to send in any questions you may have through the chat box, and I will answer them at the end of the session today. One more thing before we get started. The focus for today's presentation is for applicable large employers, or ALEs. And those are employers with an average of 50 or more full-time and full-time equivalent employees. And whether you're self-insured or fully insured, and I'll explain those terms later, you're going to need to file the 1094-C and the 1095-C this year if you're an applicable large employer. Now, the ACA is no doubt complicated, and many of us are learning it as we go. It's kind of like trying to build a plane in mid-flight. But I hope to cut through some of the confusion here with some practical insights and tips. So fasten your seatbelts. Let's get ready for an information-packed hour where you're going to learn the reporting requirements for applicable large employers, again, those with 50 or more employees, the specific employee data you'll need to track and gather from HR, payroll, and benefits, step-by-step guidance on completing the forms, as well as tips for managing the annual ACA record-keeping and reporting process. So before we dig in, let's take a quick poll here. I'm interested in finding out whether you're on schedule to distribute the 1095-C statements, the employee statements, by March 31st. And your options are yes, but we have a lot of questions, no, and we need guidance to get it done, and there's no option for sobbing quietly in the corner, but none of us are doing that. So go ahead now and click your choice there, and as they're coming in, it looks like, well, this is good, so at least you're on schedule. About 75% are on schedule to get those employee statements out on time, and about 25% still need a little bit of guidance to get it done, and hopefully we can clear a lot of that up today. So why ACA reporting? The primary purpose of these new ACA reporting requirements is to communicate key details of health insurance coverage, including verification that minimum essential coverage requirements are being met. The ACA reporting requirements are enforced by two new sections of the Internal Revenue Code, Section 6055 and Section 6056. And so we'll get into a little detail on those right here. Section 6055, which we really aren't going to get into too much today, applies to health insurance carriers, small employers that sponsor self-insured health plans, and other entities that provide minimum essential coverage, such as sponsors of multi-employer plans and providers of governmental coverage like Medicare or Medicaid. These businesses must complete the 1095B and the 1094B transmittal. The larger self-insured employers are going to be completing the C series forms that we're going to talk about in much more detail today. Section 6056, on the other hand, is directed toward employers. It's directed toward applicable large employers. Those are the ones with 50 or more full-time and full-time equivalent employees on average in the prior calendar year. The Section 6056 reporting ensures compliance with the ACA, in particular the pay-or-play mandate, the employer shared responsibility provision, its technical name. And it does this through mandatory information reporting on the Form 1095-C and the accompanying 1094-C transmittal form. Basically, if you're an ALE and you don't offer health insurance to your full-time employees and their dependent children that is both affordable and that provides minimum value, you may be subject to a tax penalty if any of your full-time employees go out to the marketplace and obtain subsidized coverage. So one of the gating issues here is, are you an ALE? Are you an applicable large employer? So you might think you're an applicable large employer, but how can you be certain? And this is where reviewing the hours of service for your workforce comes into play. Hopefully you've been tracking employees' hours, and you can pull timekeeping and payroll records to get an accurate monthly picture of your full-time employees and the full-time equivalents. So when you're calculating the full-time and full-time equivalent employees for the preceding calendar year, keep in mind that a full-time employee averages at least 30 hours of service per week, or 130 hours per month, which is the monthly equivalent of 30 hours per week. This is different from the typical 40-hour week that you might associate with full-time employees. This is specific to ACA reporting, and you kind of want to carve it in stone here at 30 hours a week for full-time status for ACA purposes. For your hourly employees, you either have to count the actual hours worked and hours, or you I should say, you must count the actual hours worked and hours paid. For non-hourly or salaried employees, you should count either the actual hours worked and hours paid, or use one of two measurements, either a day's worked equivalence, which is 8 hours for each day with at least 1 hour of service, or secondly, a week's worked equivalence, which is 40 hours for each week with at least 1 hour of service. So obviously the equivalency methods of determining the number of hours aren't very employer friendly. If the employee shows up at least 1 hour, under the week's work equivalence, you would credit him with simply 40 hours that week. So tracking actual hours may be the way to go for many employers out there. Now, with all the above, you must also include the hours that are paid, like vacation, sick time, disability, jury duty if it's unpaid, unpaid military leave like USERA, and other leaves of absence. So you're looking at hours of service, which include all time for which the employee is paid or entitled to pay, not just the hours worked on the job. There is a bit of recent guidance here that allows you to exclude payments made to a current employee under a short-term disability or long-term disability plan where the premiums were paid by the employee on an after-tax basis or included in income by the employer. So in other words, if employees are paying for the cost of their STD or LTD benefits on an after-tax basis, when they have STD and LTD claims, those payments won't be considered hours of service as long as the premiums were not paid by the employer. Managing your full-time employee count is important not only for determining ALE status, but also because it's a trigger for when employees are eligible for coverage. There are measurement methods for this as well. You can have the monthly measurement method or the look-back measurement method, and these are often used with variable hour employees, particularly the look-back method. The point is that when an employee becomes full-time, you must offer minimum essential coverage under the ACA to avoid potential penalties. Now, about full-time employees or full-time equivalent employees, your part-time workers also contribute to your overall employee count. A full-time equivalent employee is a combination of part-time employees that counts as one full-time equivalent. So to determine the number of full-time equivalent employees for a month, you add up all of the part-time hours of service in a month up to 120 per employee. And I know earlier we talked about using 130 as the monthly equivalent of full-time. This 120-hour threshold here, it is correct. It is used specifically for this purpose in determining your ALE status. So you add up the part-time hours of service up to 120 per employee, and then you divide the total by 120. And you do this for every month of the year, and then if the result, the average ends in a fraction, you round it down to the next whole number. So for example, if you have 7 employees who work 20 hours a week, you would have 4 FTEs. You'd have 7 people working 20 hours a week, which is 140. 140 times the 4 weeks in the month is 560. You divide the 560 by 120, you get to 4.66. And then at the end of the year, if your average ends in a decimal, you round it down. Once you've calculated the number of full-time equivalents, you add that to the number of full-time employees on staff to determine whether or not you're an applicable large employer. So for most of you, this is really not going to be something you need to concentrate that closely on. You know, if you have 200 employees, you're obviously going to be an applicable large employer. But if you're right on the cusp, it really probably makes sense to take a very close look and perhaps consult with counsel and have this calculation performed. So Not included in the calculation are independent contractors, seasonal employees working 120 days or fewer, and COBRA and retired employees. The rules for seasonal employees are particularly tricky, so if you think that you're not an applicable large employer because of your seasonal employees, you should talk with your trusted advisor on this issue. The rules around these workers are constantly changing, and so you should keep an eye on that matter. Something else to keep in mind here is that an applicable large employer may be a single entity, or it may consist of a group of related entities such as a parent and a subsidiary or other affiliated entities. And if the combined number of full-time and full-time equivalent employees from the group is large enough to meet the definition of an ALE, then each employer in the group, referred to as an ALE member, is part of an applicable large employer and is subject to the employer shared responsibility provisions, even if it wouldn't be an ALE separately. So even a small employer maybe has 10 employees, but it's owned by a parent company that has 100 employees. Both the 100-life company and the 10-life company are an applicable large employer. Each of them are applicable large employer members, and each have their own reporting obligation. So we wanted to clear up a couple of frequently used terms here, and that is determining whether you're insured or self-insured. And this trips up a lot of people, so let me clarify that. A self-insured or self-funded employer generally contracts with an insurer or an administrator to administer the plan, but it pays the medical claims out of the company assets. So there's no shifting of risk to the insurance company. You may have stop loss, which helps stem the employer's losses, but ultimately the risk is retained by the employer in a self-insured environment. In a fully insured health plan, on the other hand, you pay the insurance carrier's premiums each month, and it pays the claims based on the covered benefits outlined in the policy. And for example, Humana, Blue Cross Blue Shield, Aetna, these are examples of health insurance carriers. And so in those cases, the risk is shifted to the insurance carrier. If with a lot of claims, it's going to be on the insurance company to pay them, and of course you might get a rate increase the next year, but you're not responsible for actually paying the claims. In this world here, in terms of the reporting, this is an important distinction because it affects which portion of the 1095-C that you're going to complete, and we'll get into that in just a couple of minutes. Okay, so we don't want to get ahead of ourselves, and so before you can sit down with the actual forms and start the filing process, you're going to need to gather some employee data. And of course, because nothing is simple, you'll need to tap a few different departments or sources to do this, likely including human resources, benefits, payroll, your time tracking system, time and attendance. And this is what many employers out there are coming up against right now as they prepare to complete the forms, where to get those various pieces of information and how to bring everything together. And so let's try to work through some of that right now. So the information that you'll need to complete the forms includes the total employee count based on hours of service, including full-time and full-time equivalent employees. And you can most likely pull this from your payroll or your time tracking system. Employee name, social, and address, you're generally going to pull this from HR records. And then the next about 5 bullets here, whether the coverage offered, the cost of that coverage, whether the employee was enrolled, whether it was affordable, and then certain other relevant information. If the plan is self-insured, is probably going to be pulled from HR records and from benefits. And I know this is easier said than done, and we certainly sympathize with this. Gathering the necessary information from HR, payroll, benefits, and your time management system, it does require careful coordination and information sharing, and that's just to prepare to fill out the forms. For the actual reporting process, the IRS, they're estimating it takes about 12 minutes per form, and that I do suspect is a fairly conservative estimate. Most employers will need a little more time than that, which brings me to our second poll question here. And this one, I'm curious as to how are you handling the ACA reporting and filing this year? Are you doing it all in-house? Are you hiring a service to pull the data together, or maybe just to complete the forms, or using a service to capture the data and file the forms? Responses are pouring in, and wow, they look to be kind of one-sided here. Interesting. So you can see the vast majority of you brave, intrepid souls are doing this all yourself. And a combined 25% or so are either using a service to file them or perhaps using a service to file and capture the data. So a lot of you going this yourselves, and so hopefully we'll be able to give you some good tips and tricks today to help you through that process. So it does look like most of you are taking this responsibility on yourself. So that's probably why you're attending this webinar. So let's get to it and complete the 1095-C here. If you're fully insured, you're only going to complete parts 1 and 2 of the 1095-C. If you're self-insured, you're going to complete parts 1, 2, and 3. Every employee of an applicable large employer who is required to be treated as full-time must receive a 1095-C. And so that means eligible employees who decline coverage are still going to receive a 1095-C if they're full-time. So now we start to take a look at the forms, and part 1 here is really not too controversial at all. I know it's a little small, but this is basically the employer and employee information. So you're going to be entering, identifying information for the employee, such as name, address, and social security number, and then identifying information for you as a company, such as the company's name, employer identification number, and address. Part 2 is really where the meat is here. This is all about the offer of coverage. In these 3 lines in Part 2, you're going to enter information about the health coverage offered by month, if any, the lowest cost premium for self-only coverage under the plan, and the months in which you meet an affordability safe harbor provision. And then a little lower on the page, Part 3, if you're self-insured, is where you're going to be reporting about the coverage that was supplied to all covered individuals, including the employees, spouses, dependents, retirees, and COBRA enrollees. You'll need social security numbers, or if these aren't available, dates of birth for the dependent. This Part 3 here is not completed by the employer if you are fully insured. That information is captured separately by the health insurance carriers and provided on the 1095-B. You're only completing Part 3 if you are self-insured. So as I mentioned, the bulk of the work in completing the 1095-C is really going to be in lines 14 through 16 of Part 2. This subject is complex enough that we could talk about this every day for a week, but I'd like to share a few tips with you to help you get you through this section here. The offer of coverage on line 14 It involves 9 possible codes that describe the type of coverage that's offered, if any, to an employee and the employee's family members, such as the spouse and dependents. And these codes generally fall under 3 areas. And when I say MEC, I'm referring to minimum essential coverage, and MV for minimum value. So when you're making an offer of coverage, for example, code 1E is an offer of coverage that's minimum value going to the employee, spouse, and dependent. So you make a regular offer of family coverage. That's code 1E. It's going to be a very common code used by the employer, and you don't have to get that specific as to whether the particular employee you're reporting on even has a family. If you make family coverage available, you would use code 1E for all of your employees to whom you offer coverage. Likewise, another common code is code 1C, as in Charlie. That's an offer of minimum value coverage made to employees and dependent children, but not spouses. Code 1G is only used by employers with self-insured plans, and that's when you have someone who is not an employee or not a full-time employee, like a retiree or a COBRA participant, who is enrolled in self-insured coverage. You're only going to use 1G if you have non-employees who are enrolled in a self-insured plan. The other types of codes, you can have 1B and 1D. These are offers of minimum value coverage to the employee only, or the employee and the spouse, but not dependents. These are going to be pretty uncommon since one of the requirements is to offer coverage to employees and dependent children. Code 1F is for those quote-unquote skinny plans where they offer minimum essential coverage, but they don't rise to the level of offering minimum value, meaning they're not at least equivalent to a bronze plan. You might see some of those plans out there that maybe offer nothing other than preventive care benefits. Those would typically be denoted by using code 1F in line 14. And then 1H is used whenever you don't make an offer of coverage in a given month. That's just, 1H, coverage was not offered. 2 other codes that come up from time to time are codes 1A and 1I. And here, 1A is for a qualified offer, meaning you've made an offer of minimum value coverage to the employee, spouse, and dependents that is affordable under the federal poverty level safe harbor. And so the monthly cost is no more than about $93 per month. That one comes up reasonably frequently by employers that make a highly affordable offer of coverage. And then code 1I is qualified offer method transition relief for 2015. This allows you to use code 1I when you're not using code 1A, but this really offers very little relief, and I would expect that many of you who are completing these forms yourself, you're probably not going to bother with using code 1I. If there are questions on that, we can take it at the end of the webinar today. A little bit of explanation, just in case I missed it before. Under the pay-or-claim mandate, you can be penalized if you don't offer minimum essential coverage to at least 70% of your full-time employees and their dependent children, and you have at least one full-time employee who receives a premium tax credit through the marketplace. And that 70% number moves up to 95% in 2016. In general, if you want to make sure you avoid potential penalties, you want to make at least an offer of coverage to 95% of your full-time employees. That will get you out from under the big penalty, that $2,000, they call it the A penalty or the nuclear penalty. You want to make sure you offer coverage to at least 95% of employees to get out from under that particular penalty. Now, Focusing on this slide, I want to run through the types of coverage that will be deemed minimum essential coverage. It's a pretty low bar. Basically any employer-sponsored group health plan, whether it's fully insured or self-insured, is minimum essential coverage. Coverage under certain governmental programs, Medicare, Medicaid, those are typically minimum essential coverage. Getting covered through an individual marketplace in the exchange is also minimum essential coverage. There's a catch-all in there, other coverage recognized by HHS. That would include student health insurance, certain expatriate plans. The types of coverage that are not minimum essential coverage are non-major medical type of plans. So things like fixed indemnity coverage, like the hospital indemnity plans, cancer-only plans, those are not minimum essential coverage. Likewise, life insurance, accident, dental, vision coverage, these are not major medical plans, and so these are not minimum essential coverage. So a bit more on minimum essential coverage. You can have a second type of penalty that can be triggered if you offer minimum essential coverage, but the coverage wasn't affordable or it didn't provide minimum value. And that results in at least one full-time employee going to the marketplace and receiving a premium tax credit. Most broad-based medical plans meet the legal parameters for minimum value, where the plan pays at least 60% of the cost of covered benefits. Regarding affordability, the premium for the lowest cost self-only minimum value coverage should cost no more than 9.5% of an employee's gross household income, and that percentage is adjusted each year or indexed, and it rises to 9.66% of household income for 2016. You can also use 3 safe harbor tests to determine if the coverage you're offering is affordable. I'm not going to cover them in detail right now, but just so you're aware, there's the W-2 safe harbor that looks at box 1, W-2 wages. There's the federal poverty level safe harbor and the rate of pay safe harbor, and these are captured in line 16 of Form 1095-C. And one thing you'll see when you're going to fill out the forms, if there's one particular code that applies for all 12 months of the year, you only need to enter it once in the all 12-month column on Form 1095-C. So on line 15, you're reporting the lowest cost monthly premium for employee-only coverage. This is not necessarily the amount the employee actually paid for coverage, because he might enroll in family coverage or he might take a higher cost option. It's simply reporting the lowest cost option that's available to the employee to enroll in single coverage. And this helps the IRS determine if affordable coverage was made available to the employee. You will only make an entry in line 15 if you have used codes 1B, 1C, 1D, or 1E on line 14. You can either check the all 12-month box if every entry is going to be the same, or you would put the codes or the dollar amounts in the monthly boxes. And so again, you're only going to make an entry in line 15 if you use code 1B, 1C, 1D, or 1E on line 14. You are supposed to include cents with this figure and not round the numbers. So if you're charging $10.21, it'd be 10.21. And even if you're offering coverage for free, and for some reason you're not using code 1A, you would put in 0.00 along with, for example, code 1E to denote that you are not charging for that coverage. If you do qualify to enter code 1A on line 14, then you will leave line 15 blank, and you'll also leave line 16 blank as well. That's one of the benefits of being able to use code 1A, the qualifying offer. The code 1A indicates you made a qualifying offer, which is by definition affordable under the federal poverty level safe harbor, and therefore you don't need to indicate any safe harbor relief in line 16. If you put 1A in line 14, lines 15 and 16 can remain blank those months. Okay, so moving on to line 16. This again involves 9 codes, and it clarifies issues such as whether an individual was employed during the month, whether he was eligible for or enrolled in coverage, whether he was in a waiting period or other limited non-assessment period, or if he waived coverage, whether any affordability safe harbors apply. For most employees and for anyone that enrolls in coverage, then we're simply going to use code 2C as in Charlie to note the employee enrolled in coverage for every day that month. Otherwise, codes you might be likely to use when an employee waives coverage or wasn't offered coverage. 2A, the employee wasn't employed during the month. You'll use this before dates of hire and months following termination. 2B as in boy is for the employee not being full-time. Perhaps he just didn't hit 130 hours that month and you're using the monthly method to determine full-time status. 2D as in dog is for the limited non-assessment period. This one is going to come up a lot. This is used during the waiting period and also during the initial measurement period for variable hour employees and part-time and seasonal employees that are measured under that initial measurement period. There are 3 affordability safe harbors, which I mentioned a couple of minutes ago. You have 2F for the W-2 safe harbor, 2G for the federal poverty level safe harbor, and 2H for the rate of pay safe harbor. 2E is used for most union situations where you're reporting on full-time union employees who are offered coverage under the union plan, and you as an employer are contributing to that plan. There are a bunch of nuances to this rule, but that's generally when you'd use it for union employees. And then code 2I is for non-calendar plan year transition relief. Maybe you have a September 1 plan year and you weren't required then to offer coverage until September 1st. You might use code 2I for the months prior to the start of your 2015 plan year. So in a nutshell, with line 16, you're basically telling the IRS why you shouldn't be penalized under the employer shared responsibility provision. Either maybe it's because the employee enrolled, maybe you had transition relief, maybe you're using an affordability safe harbor. Whatever the reason is, this is your time to use it and put it in line 16. Now, keep in mind that leaving the line 16 blank, if you're not using code 1A, is a bit of a red flag, and you really should try to avoid it if you can. Meaning if there's a code that works, if there's a safe harbor code that works, you should use it and communicate to the IRS that you shouldn't be penalized for the employee on whom you're reporting because of whatever reason, because coverage was affordable, because the employee was in a waiting period, what have you. And of course, if no code applies for line 16, maybe you just decided to offer unaffordable coverage and the employee has waived, then you would in fact leave line 16 blank, and that would trigger some exposure to a penalty if the employee were to go out and get a premium tax credit. So part 3, again, just to be clear, it only applies if you're offering self-insured coverage, and this is where you enter information about the covered individuals. This would include covered employees, spouses, and dependents. You also prepare these for retirees and COBRA participants if you are self-insured. You'll need the Social Security numbers, or if the numbers aren't available, date of birth. And this information here in Part 3 of 1095-C, you do not complete if you're an employer with a fully insured plan, because the carrier will send that information separately via Form 1095-B. So many companies out there and many employees out there are going to receive a 1095-C from their employer and a 1095-B from their insurance company. So there are tons of different scenarios that you might encounter when completing the 1095-C, and we obviously can't go through all of them right now, but we do want to share a couple of common scenarios that might help you out here. So let's say you have an employee who started in June of 2015. This is a situation that requires one code per month, rather than checking off the all 12 months column, because obviously the offered code is going to change due to the mid-year start date. So the codes on this slide are based on the employee's relationship with you, the employer, each month. So you can see here, each month prior to the month of hire, January through May, we're going to use 1H, no offer of coverage, in line 14. We'll leave line 15 blank, and we'll use code 2A in line 16 to denote that the employee was not employed during those months. For the months the employee was in a limited non-assessment period prior to the offer of benefits, and that's June, July, and August, we're going to use code 1H again to still show there's been no offer of coverage yet. Line 15 is still blank because we haven't offered coverage yet, but we have a safe harbor code to use in line 16, and that is 2D as in dog for the limited non-assessment period. We're basically telling the IRS, look, this employee is in a waiting period, and so even though he's a full-timer for us, he's working full-time, we don't get penalized yet because we have that period during which we're offering him coverage and he's making the election. And then for the full months where the employee enrolled in coverage, and that's September through December, we're putting in code 2C. So here we're in line 16. So we're going to identify the code for line 14 based on the fact that we're offering minimum essential coverage that is also minimum value. Let's say here we're just going to use code 1E to report that offer. The premium cost is, the lowest cost option is $38 here. And for line 16, again, because the employee enrolled, we're going to use 2C to denote that the employee was enrolled that month. And then if you are a self-insured scenario employer, same scenario, you follow all the same instructions, but you're going to fill out Part 3 of 1095-C, meaning the name, social, and months of coverage for the employee and any other covered family members like children or a spouse. So that's the first one. So second scenario, let's say you have a part-time employee shifting into full-time status. And so some context here, any time employees become full-time, they're eligible for coverage. There are some nuances with that with regard to the look-back method. There are two ways to determine this with part-time employees. There's the monthly measurement method where you must offer coverage when an employee works 130 hours or more, and then there's also the look-back method where you consider an employee full-time during a future period called the stability period based on whether the employee averaged 30 hours per week in the prior period, and that's referred to as a measurement period. In between the measurement and the stability period, we have what's called an administrative period that gives you time to facilitate the employee's enrollment. You give him the enrollment forms, SBCs, he can go talk it over with his spouse, and this is a smarter approach with employers who have variable hour employees whose schedules are unpredictable. And I don't want to go into all of the nuances of how to calculate the look-back measurement method, but generally for an employee in this situation, the coding would look like this on the screen. We're going to have 1H for no offer of coverage on line 14, leave line 15 blank, and then 2B for not a full-time employee on line 16. Then if we're using a 6-month, 1-month administrative period, March through September, 1H on line 14, leave line 15 blank, and then 2D for limited non-assessment period on line 16. This one gets really tricky. It kind of matters whether the employee here is a new hire or an ongoing employee. In these situations, you really want to kind of work with your trusted advisors like efileforbiz.com or your broker or attorney who's helping you with this, and they can make sure these work for your particular situations. Here we have an employee who's starting a stability period, October through December once he's eligible, and so here if we assume that he enrolls, we have 1E on line 14, $38 in line 15, and 2C on line 16. So we've addressed the 1095-C, and we've considered a few different scenarios, but that's not all when it comes to ACA reporting. There's also the 1094-C transmittal form that summarizes the 1095-C filings that were submitted for the season. And so a good way to think of this is it acts as a cover sheet for all of the 1095-Cs that are being submitted to the IRS. And so this includes identifying information about your business, such as name, EIN, and address, whether you've made an offer of coverage to at least 70% of your full-time employees and their dependent children. And again, that 70% number goes up to 95% for 2016. You report the total number of 1095-Cs that you've attached, information about members of your controlled group or your aggregated applicable large employer group. You'll list them on Part 4 of 1094-C, and then in Part 3, you'll show the total full-time employee count by month, the regular, all employee count by month, and then in Part 2, you'll also certify your eligibility for transmittal relief. A quick tip here is that you can complete multiple 1094-Cs for your business, say for different regions or divisions, but there's only one authoritative transmittal per EIN that will consolidate all of the data. All right, so how are we doing so far? I know this is a lot to digest, but I want to emphasize something. This is a new process for everyone involved. ACA is a complex reporting, or ACA reporting is a complex topic even for the most enlightened of us, with countless questions and tons of gray areas. Because of this impact and the fact that many employers needed more time, the IRS has extended the filing deadline. So let's talk about that. Until late last year, the schedule for filing and distributing the 1095s in 2016 was the same as W-2s and 1099s. However, at the end of the year, the IRS released Notice 2016-4, which extended the deadline as follows. It gave us another 60 days to get the employee statements out, and then until the end of May for the IRS statements if you're filing them on paper, or the end of June if you're filing them electronically. And a note about electronic filing, not only is it a more efficient way to file with the IRS, it also gives you another month to do so. And further, it's required to file electronically if you're filing at least 250 of these forms. So if you're a bigger business filing a lot of these forms, understand that e-filing is really your only option. I do recommend that you check out a reputable IRS authorized e-file provider like efileforbiz.com. That's EFILE, the number 4, then BIZ.com, to meet the demands of the new ACA reporting requirements. More information on this secure and efficient service will be available after today's presentation. So obviously, you have to comply with the ACA reporting requirements or risk fairly steep penalties. Penalties can apply for a variety of reasons, including a failure to file, fail to furnish recipient statements, as well as a failure to file on time. You can also be penalized for failure to file electronically when required to do so, and again, those are employers that have to file 250 or more of these forms. And beginning with the 2015 filings, the IRS penalty for failure to file more than doubles from $100 per return to $260 per return, and even goes up to $520 for willful failures. The annual cap is right around $3 million, so it's obviously not something you want to mess around with here. That being said, you should be aware that there is a 1-year transition policy where the IRS is not going to enforce penalties for accuracy-related errors as long as you've made a reasonable good faith effort to file timely, and this does not apply for a complete failure to file outright. You should get a break if you did your best to capture everything but fell short, but certainly not if you ignore the filing requirements altogether. All right, so we're getting near the end of today's webinar, but before we wrap it up, I'd like to recommend a couple of steps to streamline this entire process for the upcoming year and to ensure that you're in full compliance here. So while this year is certainly going to be a bit of a learning curve for most of us, you'll no doubt be ahead of the curve going forward. Know when you're an applicable large employer based on the full-time and full-time equivalent definitions. If you continuously track every employee's hours of service, and again, to make you aware of services that can help with this, TrackSmart is an online tool that allows you to accurately capture employee work hours as well as some of the health plan details necessary for the 1095 forms. Information about this service too after the presentation. Monitoring employee eligibility for health coverage, which includes defining the measurement methods you'll use, tracking the cost of coverage offered and the affordability of coverage by month, informing your workforce of their health care coverage options with a written notice, as well as an ACA poster. And the notice should introduce the health insurance exchange, explain eligibility for lower cost private insurance in the exchange depending on employees' income and the coverage you offer as an employer, as well as a cautionary note about the possibility of losing the employer contribution toward coverage if you choose to go through the exchange. You can get a poster for this language available through ComplyRight, which you can check out in the follow-up email after this webinar. Moving on to the last two recommendations for managing ACA reporting, we do recommend that you create a system, ideally automated, for collecting the necessary data across various departments and sources. And certainly trying to do everything manually could be a very time-consuming and frustrating undertaking. And for this reason, you'll likely want to explore an internal platform or specific software and programs that integrate timekeeping, employee record keeping, and benefits administration, which brings me to the final recommendation here. You really want to discuss and verify your reporting needs with your payroll provider and other third-party vendors. Many of these businesses are expanding their services to assist employers under the new ACA compliance environment, and so it behooves you to take your time and research the options and determine what makes sense for your business. And with that, we have reached the end of our presentation. I think we can all take a large collective breath here. You guys can do it. I have faith in you. And just to summarize the key points we've covered here today, under the pay-or-play provision of the ACA, as an applicable large employer, you must offer minimum essential coverage to full-time employees and their dependents that is also affordable and minimum value, or you'll be subject to potential penalties. You're an applicable large employer if you have 50 or more full-time employees, including full-time equivalents. Under these reporting requirements for ALEs, you must distribute a 1095-C to every full-time employee, regardless of whether they've accepted coverage, as well as a copy of the 1095-C and 1094-C transmittal form to the IRS. If you're fully insured, you complete parts 1 and 2 of 1095-C, and if you're self-insured, you complete parts 1, 2, and 3. The biggest impact in completing the forms are going to be lines 14 through 16, which requires specific codes to indicate the offered coverage, the lowest cost option, and any of the safe harbors that might apply. Again, the deadline going forward for these in future years is going to be along the same time frame as W-2s and 1099s, but for this first year of operation here, the IRS extended the dates for this season to March 31st for the employee statements and June 30th for the IRS statements if filing them electronically. So last but not least, the ACA reporting cuts across a lot of different departments in your organization, and it requires a very coordinated approach to get everything done. You'll most likely want to create an automated system for tracking and capturing the necessary data, as well as work with your outside services and third-party vendors to manage the overall reporting process each year. Just want to thank everybody again for attending, and we are now going to turn to some questions just in case there are any questions out there.
Stacy, there are a lot of questions. Let me just preface with that and say thank you for guiding us through the ACA reporting requirements and the words of encouragement along the way. If you did have some time, if we could go through a couple more questions. I know we're toward the end of the hour, but answering a few questions I think would be great. And I do want to add to everyone that in the chat I have put in Stacy's email address. If you would like to engage with him further, if we don't get to your question today, just because there have been a great number of questions and we are pretty close to 3 o'clock. So I just want to remind everyone that you can engage with Stacy further. And I also wanted to point out that a link to our next webinar is in the chat as well if you do have to run off to another meeting. And for those of you who would like to stay, we will answer a few more questions just to make sure that we get a little bit further in the details, or if there's anything we want to revisit, we'll try to do that in the next couple minutes. Thanks again, Stacy.
Well, thank you, and you're right. We have a ton of questions here. I'm happy to stay a few minutes past the hour. Stephanie just cut me off at some point, but I'll start answering questions here, and hopefully we can run through them. I see there's a bunch of great questions here. I'm going to start at the top. First one is, if the insurance company sends a 1095-B to employees, does the employer still have to send out a 1095-C? And the answer is yes. Many employees will get a 1095-B from their insurance carrier and a 1095-C from the employer. The fact that the carrier sends out a 1095-B does not impact your responsibility as an applicable large employer to send out the 1095-C. Next question is, we are a group applicable large employer, self-funded. Our plan is from July 1st to June 30th each year. What information goes in lines 14, 15, and 16 on 1095-C? And you know, I'd love to help. This one is, you know, is obviously very specific to your plan. I can tell you that what a lot of the larger payroll vendors are doing, pardon me, reporting vendors are doing for these types of situations where you have a non-calendar year plan. If you qualify for non-calendar plan year relief, then from January through June, you can use 1H in line 14 and 2I in line 16. And then once July 1st rolls around, you'll use your standard reporting codes like 1E and 2C if the employee is offered minimum value coverage and enrolls. I'll stop there just because this one is very specific. Next question is, I've already handed out the 1095-C and sent the 1094 to the IRS based on the original January, February due dates. If I learn that I completed the forms incorrectly, can I send out corrected information? Well, yes. You know, that's kind of one of the requirements is if you discover you have a reporting error, you should correct it. And I don't want to talk out of school here. You know, when it comes down to actually having mistakes on the form and trying to figure out how you should correct it, you should talk with your advisor on that, maybe the company helping you complete them, or you know, you can engage us for help and we can kind of dig into things a little bit. But the basic premise is you do need to complete forms that have errors on them. Next question is very similar to the one we just had on self-insured plans. Our plan runs June 1 to May 31. Should I be using the relief codes for January through May for 2015? And I can't tell you that for sure because I would need to know if you qualify to use the transition relief method. If you do, then you can use them for January through May. And actually, I apologize, folks. I just realized I have another call at 3 today. So I know you can continue to, you can send in questions to ComplyRight, and they can potentially answer them as well. If you'd like to engage our law firm for assistance, you can email me. Other than that, I'd like to thank you all for today, and look forward to talking with you all in the future.
Thanks again, Stacy. If you have to go, we'll send you off. I would like to thank everyone again today for participating. In the chat, as a reminder, you have Stacy's email address. You can also visit complyright.com, and we hope to see you at our next webinar on April 12th. We're going to go into the realm of posting compliance after the ACA filing season is kind of ending and you all have your data in. We'll focus on posting compliance and to make sure your business is not at risk, and we'll guide you through the steps to take to make sure that your posters are up to date and accurate according to all the agency requirements. So thanks again on behalf of ComplyRight, and have a great day.